Now, the next element of after the introduction, we're going to visualize the precipitating factors, the mechanism first. Let us visualize the mechanism of sickle cell. Let's visualize the mechanism of sickle cell. Now, for the mechanism of sickle cell, you need to know that what? You need to know that generally the pathophysiology under sickle cell, the major mechanism under sickle cell is that the cells, the cells are normally biconcave. The cells are normally biconcave red blood cells, and that's the normal shape of the red blood cells. The red blood cells are normally biconcave, and the cells of sickle cell patient are normally biconcave. Now, when they enter into the state of precipitating factors, when they are a state of precipitating factors like stress, I'm going to explain all those stress factor or the precipitating factor which is going to initiate now the sickle cell disease or the sickle cell crisis. So when they enter in a state of precipitating factor, what happens is that the cells now are going to change their morphology and become sickle cell. So is it clear? So you need to know that what generally the cells are not sickle cell directly. Is it clear? They are normal biconcave red blood cell, though there is some percentage that is always going to be sickle cell. The cell are normally biconcave red blood cells. Only when there is a period of stress, a stress factors or precipitating factors, that the cells now become sickle shape. Is it clear? Now, this sickle cell have inability, they have increased viscosity. Is it clear? So their motility, you need to know that for one cell, the motility of the one cell through the blood vessel reduces. Is it clear? So there is a reduction in the motility of one cell through blood vessel. Are you understanding? Since there is reduction of motility of the red blood cell through the vessel, this sickle shape, it's generally going to increase the viscosity of the blood. It increases the viscosity of the blood, which is going to now make occlusion of the vessels. That's what causes occlusion of the vessels, which causes now ischemia, reduction in perfusion of the tissues. Is it clear? And then ischemia now may complicate now to necrosis. Is it clear? So that is the main physiology under. Is it clear? So this is the major point that needs to be controlled. All these points, so all you need to know that sickle cell is a chronic disease and cannot be treated. Sickle cell is a chronic disease and cannot be treated. Is it clear? So you need to know that since you cannot treat sickle cell, what you need to do is to always remove this part. So you need to remove the precipitating factor. If you remove the precipitating factor, which is the main trigger point or the igniting point, you need to know that the biconcave is never going to convert to the sickle cell shape. So what is the most important is to control these precipitating factors. Is it clear? Now let's go now to visualize the precipitating factors in sickle cell.